continuous monitoring, task-based and traditional care versus relational practice. The ability to ensure clients maintain adequate nutritional levels in long-term or continuing care is a significant challenge. With aging, a decline in interest in food generally, most often related to physiological conditions, can negatively impact our ability to eat, either independently or with assistance. The dining experience in the formal care of older adults has received substantial research focus because of its vital role in caring for clients' physical health, but also with respect to the sociocultural significance of food and its relationship to quality of life. For these reasons, nutrition in the dining experience in formal care settings is an excellent area of consideration. Using dining and mealtimes, we can consider the fundamental differences between task-focused interactions and care that is grounded in relationship. You will all remember Mabel and her favorite PSW Ian. If we consider the interactions between Mabel and Ian during mealtime, we might highlight aspects of relationship versus task-based care. Mabel has just returned from a short stay in hospital following her time in intensive care. Ian has worked with Mabel for the last 14 months, and he has always known her to have a good appetite and to be able to eat independently. During the morning huddle, she was informed that while in hospital, Mabel developed a delirium, and because of this, there has been a decline in her functional abilities. Ian is sad to hear that she has lost the ability to eat independently and wonders how this might impact their interactions. Ian knows that it is his responsibility to make sure that Mabel maintains an adequate level of nutrition. At lunchtime, Ian approaches Mabel in her room to ask if she would like to head down to the dining room for lunch. Mabel declines. Knowing that he is responsible for getting her to eat, he retrieves her meal tray from the dining room and sets about feeding her in her room. Ian puts the bib on Mabel, and she mumbles something to him as he does so. At first, Mabel is compliant, but does not seem happy about the interaction. She complains when there's food on her chin and pulls away from the spoon, complicating the task. Ian sympathizes, but is feeling pressured because the job of feeding her is taking too long. Eventually, her plate is cleaned, though most of the food did not end up in her mouth. Mabel declines dessert. This surprises Ian because she's always loved cake. Both Ian and Mabel are agitated. Ian feels sad that Mabel has deteriorated to this state. She always used to joke with him. However, today she says little, and their interactions are virtually silent. Ian resigns himself to the fact that Mabel is on a downward trajectory and will likely end up in hospital again. Before leaving Mabel's room, he removes the tray, says goodbye for now, and leaves Mabel to rest. Ian then motions to the nurse that Mabel has had her lunch and checks off the box on Mabel's chart. Ian enters Mabel's room and sits down in the chair opposite her bed to check in with her prior to lunch. Seeing Ian, Mabel manages a weak smile, and Ian is able to determine that at least for today she is quite weak and is unlikely to be able to take her regular seat in the dining room. Ian then asks Mabel if she would like to have her lunch in her room, and she nods her head in agreement. At this, Ian picks up her meal tray and returns to Mabel's room, determined to help her eat and enjoy her dining experience, despite her decline. Mabel seems listless at first, but agrees to sit up on the edge of her bed for her meal. Ian asks her if she would like to use an apron to cover up her nice bedclothes during the meal. She declines. Knowing that she is unable to eat independently, Ian pulls up a chair in front of her and places the tray on the table between them. From this vantage point, Ian can make eye contact with Mabel. This position also allows him to see if he is placing the spoonful of food in the optimal position for her to eat. As Ian helps Mabel eat, he uses what he knows about her life history in conversation. Ian talks to Mabel about her nephew and her cousin. Drawing on his knowledge of her family in this conversation seems to relax Mabel, and she listens along as he helps her to eat. Although she says very little, Ian notes that she is following along with the conversation as she takes in each spoonful of food. He's pleased with her level of engagement. She displays no agitation or discomfort. Ian notices after a short while the plate is clean. There is cake for dessert today. Ian presents dessert to Mabel with gusto, saying aloud, "This is not quite as good, but it's close." And, "I know you love Julia Child's creme brulee and her chocolate mousse." Mabel eats most of the cake and drinks all of her tea, which is now cooled the way she likes it. With the meal over, Ian tidies up the food tray and helps Mabel to take a seat in her favorite recliner. Before he leaves, he asks if she would like the radio on, and she nods her head emphatically. Ian turns on the radio set to her favorite station and says, "See you later," and heads to the nursing station to chart this care interaction.